My name is Goenuel Temucin, a little complicated name. I'm working as a research associate at the Hannover Medical School with a focus on patient orientation. And I would like to share our experiences of the course concept Kundig, Smart and Digital in Healthcare, which should improve the digital health literacy and empower people with chronic diseases. Digital patient empowerment is so important because countless digital offers make it easier for citizens to engage with their health. Information, participation, and involvement in decisions empower patients and make them more confident. In other words, they should step out of their rather passive role and step into an active role and be involved in decision-making process. But the conditions for this must be created on both sides. Empowerment can only succeed if the ability of participants to participate is promoted. But what do we need to consider when it comes to digital patient empowerment? It requires skills and trust. 90% of the German population have access to the internet. That's the first time it increased. And 82% are via mobile devices in the internet. Their confidence is more than the half of the citizens are confident in the ability to recognize untrustworthy news. And when it comes to digitization and trust, we see that 44% of the German population distrusts in companies both digital applications they use. And just under half are concerned about leaving traces on the internet. Digitalization does not work without digital health literacy. The last years showed us that health literacy is a socially increasingly relevant topic that may have the potential to become a new policy field. This is promoted by the digital transformation, which, however, still receives too little attention in the local health literacy discussion. Patients are still quickly overwhelmed by the complexity of the healthcare system in Germany and the associated health and disease information. On the other hand, the increase in decision-making options leads to the difficulty of coping with health challenges alone in their daily life. The competence, the knowledge, and one's own motivation to find health relevant and recognize information, to understand it, to appraise it, and to apply it for own individual health decisions are summarized under the term health literacy. And health literacy is increasingly found in the digitization process. More than half of the Germans, to be more precise, 58% have a low digital health literacy. This means that they have a low ability to use health information in the internet. Coincidentally or independently from a new law came up. In 2020, the statutory health insurance funds were given the legal task by the Digital Health Care Act of promoting digital health offerings and making them accessible to their insureds, as well as promoting the digital health literacy among their insureds. Yeah, with this goal in mind, we designed in a participatory approach the course concept Kundig with Barmer and self-help institutions and the scientists of Hannover Medical School. And the course objectives, let's take a look. We say we want to that the participants should improve their digital health literacy, of course, but their skills to navigate through the digital health system. And they should improve their knowledge about current digital health offerings and products, and their skills to use health-related media and applications. Here on the slide, you can see 8 themes. There are 8 categories of themes in which 22 sub-themes are contained, presented in 6 weeks. We first designed it for a 6-week course, but each of these items can stand alone and be offered. We thus addressed different aspects of health literacy and digital literacy. The course is led by 2 trained course instructors who are experts in these fields. And let's take a look of the structure of the course. I spoke about a 6-week course, but there are actually 7 appointments. We call the first appointment session 0. This is a briefing about technical aspects, how to get access to the course, inquiries of needs and requirements of the participants. And with this session 0, we ensure that the time is not taken away from the main course. We are using different methods of didactics to ensure that the learning effect of the participants is given. As you can see, short lecture inputs are one of them, but also brainstorming to exchanging ideas, to find new ideas, and exercises in partner work or individual work. Films and videos are used to activate visual processes, and we did homework assignments. They are given every course day to deepen the learning effect. And every course day, we give a conclusion of the day and give an outlook for the next day. I said before homework, but we are calling that also self-study to support the self-study and to deepen the contents. And booklet was developed for each course day, which we sent to all participants before each course day by email. This booklet contains supplementary information, links to further information, notes on self-study, and a glossary of important terms. We used different methodological approaches by the accompanying evaluation. And we did participatory observation of each course to observe how is the reaction of the participants, how is the structure and process and atmosphere of the course. We did also moderator reflection rounds after each session with the moderator, of course, but with the course leaders and the observers, to see the strengths and weakness of the concept as well as potential for improvement or modifications. At the end of each session, we asked the participants to give us feedback about their learning experiences on that day. And we did standardized questionnaire of the participants at 2 measuring points before and after the course, which include health competence, increase in knowledge, self-efficacy, relevance of the themes, and so on. And we use the digital health literacy instrument and ASCO. ASCO is in general self-efficacy short scale. We trained a total of 95 people in 8 pilot courses. And who are the participants? I want to share this with you. 77 people provided sociodemographic information. As you can see, men are on average 10 years older than women. The level of education is predominantly high across genders. 70% of the participants are chronically ill, and 27% requested that they are relatives of chronically ill persons. Yeah, in order to evaluate the empowerment changes of the participants, we ask them to judge their confidence in dealing with the themes of the course using 4 answer categories that you can see on the slide. Here you can see also an example of these questions, and I would like to share you on the next slide the results of 11 of these themes. This graphic shows the improvement of confidence and personal skills of the participants in these 11 themes. For the other 11 themes, the participants also reported more confidence in dealing after course participation. In the questionnaire free writing section, participants made statements about their impressions. Here are 3 examples of such statements. First one, the digital world before was like a wheel or fork, now you can look more concentrated, or I have gained new knowledge about things I have not dealt with before. I came to the course skeptical because I had no little idea about the topic. My fear was taken away. We have here take-home messages. According to the initial results, a 6-week course can strengthen the participants' confidence in their personal skills and empower them. In principle, a broad rollout of the CONIC course in digital, also in face-to-face form, is possible. This can be implemented with the support of self-help, especially for chronically ill people and members of self-help. The CONIC concept is equally useful for insured persons and interested citizens. It could be offered through health insurance funds or various educational institutions. However, this requires a comprehensive quality assurance concept. This includes a manualized program in terms of goals, content, didactics, and materials. This also requires a train-the-trainer concept to qualify the course instructors, we call them multipliers, in terms of content, didactics, and technology. With that in mind, we are excited to see how the course concept can be further developed or even be further adapted into another course structure. Yeah, thank you very much for your participation.